Hi everyone, my name is Selena Belisle and I teach the Reflexology program at CE Institute. And what I'm going to show you next is a tiny little zone reflexology routine, excuse me, that we put together for our oncology students at the school. This little routine is a very simplified way to practice foot reflexology for those who don't have several hours or the full day to practice reflexology. Maybe you just want to learn a little alternative body work for a client that is contraindicated for full body circulatory massage. Well, this is it. And this is great to use for oncology clients and on people who have survived cancer, whether they're in active treatment or not. It's away from the airway during COVID-19, which makes us even safer. And if you're unsure if an area has received radiation and maybe they have a loss of sensation, so you can no longer press in the area, or maybe there's some other detrimental side effects. Maybe somebody has lymphedema because they had some lymph nodes removed with metastasized cancer. Little mini zone foot reflexology routine is a wonderful form of body work that can be provided as an alternative to regular massage therapy. Let me give you a little bit of information. The definition of reflexology is it's a balance of an art, application, and science. So it's balancing the three. Your art, which is creatively thinking about where your reflex points are and imagining where they are in the feet based on the body. And I'm going to go through the charts so you can understand that next. It's also your application. So you are manually applying it. This is done as a manual medicine. It's with your hands. Okay, this is your medicine, it's your tools, your hands are your tools. And then the science of it. We have a lot of good research that shows the efficacy that reflexology is effective for cancer patients and relieving a lot of their medical side effects and symptoms that result from some of these really strong treatments that are used to kill and fight cancer. So what we're trying to do is use the balance of art, application, and science to help heal and promote well-being through the stimulation of reflex points. Reflexology can be practiced on the feet, hands, or ears. In this class, we're just going to briefly give you some foot reflexology knowledge and practice in a little routine so that you can practice on the feet. So to understand foot reflexology, we want you to look at the chart of the feet. Now, the zone reflexology chart is a lot more simple than this one, but in order to understand the zone reflexology chart, I think it's pretty good to go over this visual right here. If you have no experience with reflexology whatsoever, I want to share with you, and for those who do, this is a great review for you. I want to share with you that the bottom of the foot is kind of like a replica of the body. So anything in the top of the foot, at the tips of the toes, all the way to the base of the toes, this represents the head and neck area on the human body. This is where the reflex points are throughout the toes of the head and neck area. The reflex points for the chest, the lung, or the heart would be right here in the ball of the foot, underneath the base of the toes, and just at the end of the ball of the foot right here. These are the reflex points for the chest area. And then anything under the ball of the foot and before the heel would be considered the reflex points. You would stimulate in here with your thumbs or your knuckles to work on or try and wake up your stomach or digestion, or the kidneys or the liver, or your adrenal glands. Maybe the person feels sluggish. We want to try and maybe wake up some of these systems of the body and get them actively working again to reduce some of the oncology fatigue that the majority of oncology clients suffer and so forth. The most popular theory about how reflexology works is there's 7,200 nerve endings in the bottoms of the feet that correlate to all these different organs and systems of the body as it's depicted right here. And it's thought that by stimulating these nerve endings on the bottoms of the feet, you're actually sending messages, stimulation to the corresponding organs and systems of the body to bring awareness to them, to wake them up. I'm recording this during COVID-19. And right now they're vaccinating people. And when you think, what is a vaccination? The vaccination is not fighting the virus itself. This vaccination is priming our own immune systems to fight COVID-19. So what's happening is with this vaccination, we're waking up our own immune system to fight COVID-19 so we have lesser side effects and hopefully less of us will die with the acquisition of COVID-19. Well, reflexology, it's a little bit similar to that in the working theory in that we're stimulating the reflex points to wake up different systems and organs of the body to get them functioning better again, to create that better homeostasis than what an oncology client might suffer with when they're receiving drugs and radiation and other things that might suppress the different organs and systems of the body. Now, we do have some science and research that show that reflexology with cancer patients is incredibly effective. And we'll provide one study for you during this little training right now. It's an April 2017 study that was used for cancer patients, breast cancer patients who had undergone radiation. And it was looking at the effects of reflexology with pain, insomnia, and fatigue disturbance. And they found that there were significant lower levels of fatigue after foot reflexology was practiced. They also found that the quality of life was preserved with the reflexology group that received reflexology, and that the reflexology group also demonstrated a significant improvement in the quality of their sleep. This is wonderful because oncology clients are often fatigued from the cancer or cancer treatments themselves, sometimes both. So let me show you what zone reflexology looks like. These are the 10 energy zones of the body. They run vertically throughout the entire body, and then they split as they come down the legs. There's 5 energy channels down each leg, left and right legs, and they just go up. They meet at the trunk and become 10 zones. They go up to the axillary area and they branch down the arms. There's 5 zones. And these energy channels also continue up through the neck and through the head as well. So what we're trying to do, excuse me, is we're trying to work in these energy zones and stimulate these different energy zones. And in our little 7-minute instructor demonstration of zone reflexology that we're going to show you in this little training, we're actually gliding up all these different zones, the 10 total zones, 5 zones on each side, and they run between the toes all the way down to the base of the foot. Now, we've colored these and we've broken them down into 4 different categories. It's not just we've done it. This is a common reflexology practice. I know it is simplified, modified reflexology, and a lot of people just call this zone therapy or zone reflexology. It's a modified version of reflexology without having to learn all the very specific points of the body. It's thought in zone reflexology that anything in this red area, so anything from the base of the toes to the tip top of the toes, is the head and neck reflex points. Anytime you're pressing in these areas, doing reflexology strokes in these areas, that you're working the head and neck area of the body, waking up that area. Anything from the base of the toe, and this incorporates the whole ball of the foot, to the base of the ball of the foot. So from the base to the top of the ball of the foot, right underneath the toes. This is the chest cavity. So this is the lung and breast area and heart. Anything that's in the chest or thorax area is right here. And your diaphragm would probably be right here between your chest cavity area and the organ area depicted in the green. In the green, this represents your stomach, your intestines, your liver, your adrenal glands, your kidney, your gallbladder, your spleen. Your entire organ area is represented in this green area. And then down here in the blue area, this represents your lower body itself. So if somebody had sciatica or reproductive issues, these would be the points here in the heel area and up around the ankles are representative of those reflex points. So in zone reflexology, we're going to work the whole foot to stimulate all of the reflex points throughout the body. And then for those who are working with cancer, maybe you have a breast cancer, you can spend a little bit more time just thumb gliding through the different zones of the chest cavity area and the yellow here over the ball of the foot, and maybe try and bring some healing and wellness to the chest cavity area. You are not going to cure cancer by practicing reflexology, but you might be able to bring some pain relief to the area and some attention and some wellness to the area through stimulating the reflex points with reflexology. So in our little routine today, we're going to practice thumb gliding through the 10 zones of the feet. Okay, it's very simple. Many times people practice thumb walking, which looks a little bit like this. We're going to do thumb gliding instead. It feels a little bit nicer for oncology clients. And if they want to fall asleep during the session, so be it. We want them to feel comfortable and relaxed and wake up rejuvenated and feel well again. We're also going to practice a spinal twist, lung press, and we're going to stimulate the solar plexus reflex points. I love doing that because people they think that they're still receiving the body work. They don't even know you've left your feet. And I'm going to teach you how to do that in this little instructor demonstration as well. So our instructor demonstration today only has about 7 points of, or 7 steps of the feet. We're going to wrap the foot, we're going to perform joint range of motion. And when I do this instructor demonstration, what you can do is follow along steps 1 through 7, and you'll see each step provided in detail as I pass through the reflexology here. So let me just cue up your video and we'll play your little demonstration, and I'll narrate what I'm doing with each stroke, steps 1 through 7. And it looks like this. So step 1, we're going to come over to the table and we're going to wrap the right foot. In reflexology, we usually start on the left foot. And then after we start on the left foot, wrap the right foot, I'm going to do step 2, which is perform ankle joint range of motion. We'll go clockwise and counterclockwise. And for clients who haven't been touched in a long time, they have cancer. Up until the 70s, they were hiding grandma in the attic if she had cancer. Still people that think it's contagious. It's not. People who have who are in oncology situations need the most touch of all. Touch can be very healing. It's manual medicine. Now, this is step 3, where we're simply massaging a cream on the client's feet. You want to provide a pH balance cream so you're not removing their acid mantle. And now we're simply gliding up the zones of the feet. We'll go straight through the toe. So you just saw me go right underneath the pinky toe. And now we're going on the 4th toe straight up the zone. And just as we glide, we're trying to stimulate all the reflex points of the foot. Now, I'm only passing through these zones 1 time each. I'm going to assume that you would be able to do this on your own and pass through the zones 3 to 5 times each. It's very simple to do, but just for a matter of instructor demonstration, we're just going to do these once. Now, after we pass through all the different zones of the foot, I'm going to stand to the side of the table, and I'm going to do something called the spinal twist. In the medial foot, this is where all the spinal reflex points are for your cervical, thoracic, and lumbar spine. Your cervical spine is in your big toe on the medial portion. From the base of the toe to the top of the heel, that would be your thoracic spine reflex points. And then the heel, from the top of the heel to the bottom of the heel, that would be your lumbar spine reflex points. And just petrissaging up and down over these reflex points is called the spinal twist, a very popular and common technique in foot reflexology. The next thing that we're going to do here is the lung press. The lung press uses your knuckles, just the first knuckles of your fist, and you're applying them right underneath the base of the toes. And you're pressing into the ball of the foot and then waving the foot back for more pressure and more lung press. And it's done very rhythmically. It's very nice and soothing. Just make sure that you're not rubbing your knuckle against any bones that you're finding in the feet. You want to be nice and soft with those knuckles, but give a nice wave with the pressure as well. After we've completed that, we're going to take and unwrap the right foot, and we're going to take that towel and wrap the left foot with it. The reason why we're doing this wrapping, oncology clients are often cold. I worked at the Miami Cancer Institute in the chemotherapy infusion suites as a volunteer, and one of my jobs, literally, I was constantly going to the blanket warmer and grabbing warm blankets for our oncology clients who were cold while being infused with chemotherapy. So now we're on the right foot, and we have taken care of number one, which is wrap the left foot, and we're performing step number two, which is joint ankle range of motion in clockwise and counterclockwise position. After we've done our range of motion, we're going to apply a little bit of massage cream. You want to make sure that it's got a pH of an acidic cream somewhere between maybe 4.5 and 5.5. So there continues to be a little bit of an acidic film on the skin so that bacteria and virus cannot thrive. The acidity will hopefully kill some of that that's exposed to the client through their skin. And now we're going to do our zone therapy, which is what we're going to just run our thumb. It's just thumb gliding up through the 5 zones of the right foot. Remember, there's 10 zones of energy traveling through the body in zone reflexology. But when we get to the feet, it's 5 zones on one foot and 5 zones on the other, making a total of 10 zones. And again, on the right foot, I'm only passing through each zone one time. You could pass through the zones 3 to 5 times each. You could run and do the first toe to the 5th toe and then repeat that 3 times, or you could do like the baby toe 3 to 5 times, the 4th toe 3 to 5 times. Your choice on how you execute that. Next, we're doing the spinal twist, which is we're working the reflex points of the medial foot, which are the spine's reflex points of the body. If you think about the spine, it runs up the middle of the body. And that's why the medial portion of the foot is the spine reflex points. Remember, any area on the foot, it kind of matches the same area where it is on the body. If you look at the foot as a total person on the bottom of the foot, on the sole of the foot. This is just a nice rhythmic stroke. You can do your petrissage from the seated position, but your wrist would be bent backwards, which is why we stand up to do your spinal twist. It's a good position on the hands. It feels wonderful for the clients. Next, we're going to do a lung press. So we're pushing into the base of the foot, the ball of the foot, and right underneath the toes. I just switched hands just so you could see the technique a little bit better on camera. And we're just pushing from the top of the ball to the bottom of the ball, rhythmically pulling the foot back, and that is called the lung press. Very common and popular reflexology stroke in foot reflexology. Whether you're doing zone therapy, zone reflexology, regular foot reflexology, spinal twist and lung press are 2 of the most popular strokes. And the last thing that we're going to finish with here is step 7. It's pressing into the solar plexus. Your solar plexus is usually 1/3 of the way from the top of the foot, 2/3 from the bottom of the foot, and about 1/3 of the way inside the foot from the medial aspect. And we're just going to press with some good pressure, not with your thumb tip, but with your thumb pad. And you're eventually going to release and release and release pressure. It takes about 30 seconds you could spend up to 60 seconds releasing pressure. And when you finally release,
the client should have a feeling that you're still there pressing in their feet. It's a really cool point, and they feel like that energy is being provided from them all day with stimulating this point. Not all clients feel it, but many do. I've gotten up and sanitized my hands after finishing the reflexology session like this. This is how we finish all of the reflexology sessions at the school. And it's interesting, our reflexology clients, I go to the top of the table and they're scared. They're like, oh my goodness, I thought you were still on my feet, because that's what they feel when we're working on that pressure point, which is the solar plexus point. And that's how we end. So that's what I have to share with you for foot zone reflexology for oncology clients. We hope you enjoyed the presentation. It's very simple. We're working the 10 zones of energy of the feet. We're gliding up these different zones to stimulate the different reflex points throughout the entire bottom of the foot. We feel that there's about 7,200 nerve endings in the feet that correlate to different systems and organs of the body. And by stimulating these nerve endings in the feet, we feel we're bringing an awareness to that area in the body that might be sluggish or not performing well, and bringing attention to it is hopefully waking it up and getting it to do its job again, and also give a nice feeling for the client. Oncology, these zone therapy reflexology sessions can be added to our suite session that we teach in our oncology education. We do have a little foot treatment that we do at the end of the suite session, or you can do these independently as their own little mini appointment, especially if you're working in a cancer hospital where I was, where you can go and spend a few minutes with each client while they're there at your facility. So we hope you enjoyed the session, and we'll look forward to seeing you in greater trainings.